Welcome to the School-Based Healthcare Services Training, Billing for Mental Health Services. This training is intended for mental health professionals who participate in the School-Based Healthcare Services program. In this training, we will take a look at which providers can participate in the SBHS program, which students are eligible to bill for, covered and non-covered services, how to bill for and document your services, and how to provide and bill for telemedicine services. Please note that a PDF of this training with active hyperlinks is available on the SBHS webpage at www.hca.wa.gov/SBHS. SBHS Program Overview. The School-Based Healthcare Services, or SBHS program, is an optional Medicaid program which provides reimbursement to contracted school districts, ESDs, charter, and tribal schools for providing medically necessary health-related services to Medicaid-eligible students who receive special education services per an IEP or an IFSP. This program allows school districts to receive reimbursement for services that they are already federally required to provide per the Individuals with Disabilities in Education Act. The SBHS program does not cover all of a school district's costs for providing special education and related services, but it can help supplement the district's budget. School districts can use their Medicaid funding to hire additional staff, purchase assistive technology, or pay for professional development. It is up to each district how they spend their Medicaid dollars. The SBHS program is administered by the Healthcare Authority, or HCA. HCA is the state Medicaid agency in Washington, and it is also the agency that manages the health benefits for state and school employees. The main contact for the SBHS program is the SBHS Program Manager. Any questions about the program should be directed to your district's SBHS coordinator or directly to HCA's SBHS Program Manager. Many parents and/or schools worry that if their school district participates in the SBHS program, this will somehow affect services that students may receive outside of the school. Please note that receiving services through the SBHS program will not affect services that students receive outside of school. Eligible providers. The following mental health providers are eligible to participate in the SBHS program: Department of Health licensed psychologists, Department of Health licensed social workers, Department of Health licensed mental health counselors, as well as Department of Health licensed mental health counselor associates and non-licensed school staff practicing under the direction of a licensed provider within their scope of practice. The requirements on this slide apply to licensed mental health providers. In order to participate in the SBHS program, providers must hold active and unrestricted licensure or certification with the Washington State Department of Health as one of the mental health providers outlined on the previous slide. Providers must have a national provider identifier and must also be enrolled as a servicing provider under the school district's Provider One account. As stated on the previous slide, LMHCAs must practice under the direction of a Department of Health licensed provider per their scope of practice. Provider One is Washington State's electronic Medicaid billing system. If you are a licensed psychologist, licensed social worker, LMHC, or LMHCA, your district's SBHS Medicaid coordinator will need to collect information from you, such as your Department of Health license number, your date of birth, social security number, and NPI, in order to enroll you as a servicing provider under the district's Provider One account. Billable services that you provide are then entered as claims by either the district's SBHS coordinator or a third-party biller. Although you are enrolled as a provider in Provider One, you will not need access to the Provider One system, as you will document your services elsewhere. We will take a look at the documentation piece a little bit later on in this training. Non-licensed school staff providing services under the direction of a licensed provider do not need to be enrolled in Provider One. Any services provided by non-licensed staff are billed under the Supervising Provider's NPI in Provider 1. Supervision requirements for mental health services can be found in the Department of Health relevant RCWs and WACs. OSPI supervision requirements can be found on OSPI's website. In addition, Medicaid requires that the supervising provider review and sign off on all treatment notes maintained by LMHCAs and non-licensed school staff. Eligible students. In order for a school district to receive reimbursement through the SBHS program, a student must have an IEP or IFSP with related services. The student must have active Medicaid coverage, and the district must have received parental or guardian consent prior to billing for services. Please note that school providers are not required to determine eligibility information. You should receive a list of eligible students from your district's SBHS Medicaid coordinator, or this information should be loaded into the documentation software provided by the district's third-party biller. If you are not sure if you should submit claims for a certain student, please contact your district's Medicaid coordinator. Typically, special education and related services are provided in the school setting. However, the SBHS program also provides reimbursement for services provided in the natural setting and in an alternate setting in accordance with the Individuals with Disabilities Education Act. If services are provided in a setting other than the school, providers must document this in their treatment notes so that the correct place of service can be entered in the claim in Provider 1. The SBHS program also reimburses for services provided through audiovisual and audio-only telemedicine platforms. Covered and non-covered services. The SBHS program provides reimbursement for IEP or IFSP evaluations and re-evaluations, as well as for the direct IEP or IFSP services, such as audiology, mental health, nursing, occupational, physical, and speech-language therapy services. In order to receive Medicaid reimbursement for IEP or IFSP mental health services, the services must be ordered or prescribed by a licensed physician or other licensed healthcare provider within their scope of practice. School-based mental health providers who hold DOH licensure may evaluate, diagnose, and provide services without a script from an outside physician within their scope of practice. However, it is recommended that licensed providers review the DOH regulations relevant to their provider type to ensure they are recommending and providing services per their scope of practice. Medicaid does not pay for services if prescribed or recommended by non-licensed school staff, such as non-licensed school psychologists, non-licensed social workers, or non-licensed school counselors. If the district or ESD does not have a licensed mental health professional on staff who can prescribe IEP or IFSP mental health services, a prescription or referral from a licensed community provider must be in the student's file in order for the district to bill for IEP or IFSP mental health services. As a school-based provider, you are often multitasking and doing many things in addition to service delivery. There may be additional activities mental health providers provide on a daily basis. However, Medicaid will only pay for direct health-related services provided to the student. Services such as attending IEP meetings, observation of a student, parent consultation, and reviewing records are not Medicaid billable services. Many of these activities are already built into the rates assigned to each direct service code. It is very important to remember that when you are documenting the time spent with each student, you are only documenting the time spent providing direct services. Billing for services. In order to be reimbursable through the SBHS program, Mental health or counseling services must be included in the IEP or IFSP as either a special education, related, or consult service. The IEP or IFSP must state the frequency of services and who will be providing the services. If mental health or counseling services are listed as a consult service, services are only reimbursable when the provider is providing direct services to the student. Consult services provided to another staff member or parent are not reimbursable. The SBHS program will not reimburse for services provided in excess of what is written in the IEP. For example, if the IEP states that the student requires services 2 times a week, but the student actually receives services 3 times a week, the provider can only bill for 2 sessions, since that is what is written in the IEP. However, makeup sessions may be reimbursable when the provider clearly documents in the treatment notes that the session is a makeup session, as can be seen on this slide. When providing services as part of group therapy, the provider can bill for the direct time spent with each student. In addition, when 2 or more providers provide services to the same student on the same day, both providers can bill for the direct time spent with the student. Providers must clearly document when services were provided as part of co-therapy or group therapy, and providers must only bill for the time spent providing services to each student. In order to record what services you provide, the SBHS program utilizes procedure codes. If you've worked in a hospital or clinic setting, you know that all medical procedures have a corresponding procedure code. There are literally thousands of codes available, but the SBHS program utilizes 7 mental health codes, which are listed in the SBHS billing guide. Mental health professionals should ensure they have access to the current SBHS billing guide at all times in order to ensure they are using the most appropriate codes for the services they provide. Providers must use their professional judgment when determining the most appropriate code to use for the services provided. The SBHS program manager can provide guidance on SBHS policies and procedures, but cannot inform providers which code to use. Providers may seek guidance from a current procedural terminology manual for appropriate use of the mental health codes. When billing for IEP or IFSP evaluations that result in an IEP or IFSP, which includes mental health services, licensed mental health providers will choose one or more of the evaluation codes found on this slide. Providers may review the SBHS billing guide for additional information on how to bill for these codes. Licensed mental health providers may only bill for evaluations if the evaluation results in an IEP or IFSP that includes mental health or counseling services. For example, if you are asked to evaluate a student to determine if she requires mental health services, and you determine the student does not require those services, even if an IEP or IFSP is written for this student, you would not be able to bill for the evaluation. If, however, you perform an evaluation and it is determined that the student does require mental health services in the IEP, you would then be able to bill for the evaluation. Please note that only licensed providers may bill for evaluations. Licensed mental health counselor associates and non-licensed school staff cannot bill or provide evaluations or re-evaluations. When providing direct IEP or IFSP mental health services, such as counseling, there are 2 codes that the SBHS program utilizes. S9445, individual counseling, should be used when providing one-on-one mental health services to a student per the IEP or IFSP. S9446, group counseling, should be used when providing therapy to a group of 2 or more students. Please note that any services provided by non-licensed school staff must be billed under the supervising provider's NPI in Provider 1. All procedure codes are either timed or untimed. When providing services, providers should be aware of whether a code is timed or untimed to ensure they are documenting and billing appropriately. For timed codes, each measure of time as defined by the code description equals 1 unit. For example, code 96130 is timed per 60 minutes, which means that 1 unit equals 60 minutes. In contrast, untimed codes are billed as 1 unit for the session, regardless of how long the session takes. Both the individual and group counseling codes are untimed, meaning that providers can only bill for 1 unit of each of these codes per day per student. The SBHS program follows the National Correct Coding Initiative, or NCCI policy. The NCCI policy was created by the Centers for Medicare and Medicaid Services in order to promote national correct coding methods. NCCI assists the HCA and the SBHS program to control improper coding that may lead to improper payment. The NCCI policy has 2 edits: procedure-to-procedure edits and medically unlikely edits. Procedure-to-procedure, or PTP edits, prevent improper payments when incorrect code combinations are billed for the same client on the same day by the same provider. Medically unlikely edits, or MUEs, are the maximum unit of service a code can be billed for the same client on the same day by the same provider. If claims are submitted that violate the NCCI policy, claims will deny. In order to avoid claim denials, providers are encouraged to view the CMS NCCI website to ensure they are billing properly. If you've worked in a hospital or clinic setting, you know that in addition to procedure codes, each procedure also requires a diagnosis code in order for insurance to pay. The SBHS program utilizes one diagnosis code, R69, which stands for Illness Unspecified. As a provider participating in the SBHS program, you don't really need to worry about this, as this information is entered on the claim in Provider 1 by either the district's Medicaid coordinator or the district's third-party biller. You do not need to record the diagnosis code on your treatment notes. However, I just wanted to provide this information as a reference. Your school district may have additional time limits for when treatment notes are due. However, Medicaid's time limit for SBHS providers to submit claims are outlined on this slide. Providers must submit the initial claim to Healthcare Authority within 365 calendar days from the date of service. Within 24 months of the date of service, a provider may resubmit, modify, or adjust an initial claim that was assigned a transaction control number. Claim submission is typically done by your district's Medicaid coordinator or your district's third-party biller. Documentation requirements. When participating in the SBHS program, providers must follow Medicaid documentation requirements, which requires providers to keep detailed treatment notes that justify all billed claims. Treatment notes may be kept in electronic or handwritten format. Treatment notes must be maintained for 6 years from the date of service. Treatment notes must contain the following information: the student's name, the student's date of birth, student's Medicaid Provider 1 ID, the date of service, and for each date of service, the time in and time out, the procedure code, a description of the service provided, child's progress to each service, and a note whether the service was individual or group therapy. Notes must be authenticated by the provider who performed the services with either a handwritten or electronic signature. So what does this look like in practice? Some school districts contract with an outside billing agent or third-party biller who will assist the district with submitting Medicaid claims. If your school district contracts with a third-party biller, you will keep your treatment notes in whatever software the billing agent uses. Some examples of documentation software include Whammer, EasyTrack, or Embrace IEP. As mentioned previously, supervising providers must review and co-sign any treatment notes kept by LMHCAs and non-licensed school staff. This can be easily done within the electronic documentation software. After the treatment notes are reviewed and signed, the third-party biller then uploads the information as a billable claim into the Provider One system. The process is similar if your school district self-bills. With self-billing school districts, it is recommended that each provider within the district keep their treatment notes in a template, either handwritten or electronic, to ensure Medicaid documentation requirements are met and to ensure the person who is entering the information into the Provider One system has all relevant information for the claim. Telemedicine. Telemedicine is when a healthcare provider uses HIPAA-compliant, interactive, real-time audio and video telecommunications to deliver covered services that are within the provider's scope of practice to a student at a site other than the site where the provider is located. As a school-based provider, you may be asked to provide services through telemedicine at one point or another. On these next few slides, we will review documentation requirements and other important information as it relates to telemedicine service delivery. The SBHS program pays for mental health services provided through telemedicine when services are provided through HIPAA-compliant audiovisual telemedicine platforms or when provided through audio-only telephone. Please note that the only code that can be billed through audio-only telephone is S9445 for individual counseling. The rest of the mental health codes found in the SBHS billing guide can be provided through HIPAA-compliant audio-visual telemedicine platforms. When providing services through telemedicine, there are two key components: the place of service and the modifier. These pieces of information must be included on a claim in Provider One to indicate that the service was provided through telemedicine. Now, you as a provider may not see these pieces of information as you are documenting your services, but it is very important that you are choosing either the appropriate drop-down in the electronic documentation software if your district uses a third-party biller. If your district self-bills, you must ensure you follow the telemedicine documentation requirements that we will go over on the next slide in order to ensure that your district's Medicaid coordinator can enter the claims correctly in the Provider One system. In addition to documenting and submitting a claim for the actual service provided through telemedicine, providers may also submit an additional claim for a telemedicine facility fee if the criteria on this slide are met. The student is located at the school, the provider is located in another location, and services are provided through HIPAA-compliant audiovisual telemedicine. It is recommended that providers confirm with their district's SBHS Medicaid coordinator or the district's third-party biller to ensure that they are billing for the telemedicine facility fee correctly. In addition to the documentation requirements outlined in the SBHS billing guide and in slides 34 through 37 of this training, when providing services through telemedicine, providers must also document the location of the student, the location of the provider, and the type of platform used. Depending on the treatment note template you are using, documenting this information may be as simple as choosing the correct dropdown or clicking a box. If your district keeps handwritten treatment notes, you may need to handwrite this information into the note, depending on what your treatment note template looks like. Resources. One resource available on the SBHS webpage is the SBHS Billing Guide. The SBHS Billing Guide is essentially the program manual for the SBHS program. The Billing Guide is intended to be used by school district administrators, SBHS Medicaid coordinators, as well as providers who participate in the program. The Billing Guide details how to bill correctly for SBHS services, including current billable codes, documentation requirements, how to bill for telemedicine, etc. The guide also lists SBHS covered services, non-covered services, information on program monitoring, eligible provider types, eligible students, etc. In most cases, answers to frequently asked questions can be found in the SBHS Billing Guide. A link to the current and past versions of the guide is available on the SBHS webpage. Providers may print out a copy of the guide. However, it is recommended the guide instead be accessed and viewed electronically. This ensures the provider is viewing the most recent version. In addition, there are active hyperlinks throughout the guide, which can only be accessed if viewing electronically. The SBHS program sends out email notifications via Gov Delivery. Providers are encouraged to sign up to receive SBHS notifications to ensure they are kept up to date on program updates and changes. Providers can sign up to receive SBHS Gov Delivery notifications by visiting the SBHS webpage and clicking on Sign Up for Email Notifications found at the bottom of the webpage. Providers may also view past program notifications by clicking on View Past Program Notifications. Please note that if you are trying to view past notifications on Google Chrome or Microsoft Edge, you will need to install an RSS feed extension in order to view the notifications. Directions on how to do so can also be found at the bottom of the webpage. This concludes the School-Based Healthcare Services Training, Billing for Nursing and Health Services. Any questions about today's training or the SBHS program may be directed to Shanna Muirhead, HCA's SBHS Program Manager, or to your district's SBHS Medicaid Coordinator. Thank you and have a great day.